Hello everyone, I'm Dr. Chhavi Mehra, Quality Head, Senior Physician and a practicing internist at RxDx. Today, I wanted to talk about something which is very pertinent at this time. I think India has done very well, and I think we have been able to control the rate of growth of the virus in the country, and we have a very controlled death rate and the positive rate throughout the country, though worse in certain areas and extremely good in areas like Kerala. I think we all need to know that at a certain point, this complete isolation or lockdown, as I call it, has to end. It cannot be a permanent feature. And I thought coming out and having a discussion in front of you here, how I as a doctor recommend people to start working on normalizing their day-to-day lives along with COVID and the presence of COVID. But to start that, I first want to explain that the fear of getting infected, the fear, I'm seeing a mortal fear in people that if we step out, we will get the virus. Or anybody else who steps out in my community will make me susceptible in getting the virus. What this is creating is distance and intolerance. I don't think that's possible for long. And within us, we have to understand why we have to slowly get used to having COVID-19 in our lives, day-to-day lives, but be careful and protective. So before starting, I want everybody to understand that having older people in your homes and people with chronic diseases or cancer survivors in the house, those individuals have to be more particular than everybody else. But my talk today is about general population, and it covers various aspects of day-to-day life by which a person can start living with COVID-19 with care. So that is why I would like to call this moving on with care and COVID. Right? Talk about travel. So there will be a necessity in the world in the coming months where people can travel. They have to travel. So let's use the word have to travel and work towards what is required for our safety, because security checks, hand baggage checks, those areas are very, very well known for bacterial and virus infestation. How do? We make sure we wear our masks at all times. We make sure we're a 6 feet distance. We make sure we have a hand sanitizer by which we clean the trolleys, we clean the luggage handles, we clean at any point our luggage is handled by somebody else. We have to make sure we clean it all over again and again and again. When you're sitting in the plane itself, please wear a mask at all times. Make sure you go and wash your hands. Using a bathroom, try and use them before you board a plane. But if you really have to go, you have to go. Using all sanitary protection that you have utilized. There'll be seat covers, there'll be sanitizers. Wash your hands very well. Try to open the doors in and out without touching if you can. But if you touch, sanitize again. Be mindful where your hands were. Be mindful of sanitization. Do not touch your face at any point and your eyes or your mouth. Learn to keep your hands away from your face. You can travel and you can travel with safety. We will all have to live as normal as possible. We have to live as much social distance as possible. We have to live with as much mask that we can wear and keeping our hands off our face. I wish you all good health, safety, and you should know that every single person has a role in controlling this virus. Every single person that does social distancing, wears a mask, washes their hands, and respects their community. And they all have a role. And as long as the virus takes months and years to penetrate a society, the safer we are. We're not trying to abolish. We're just trying to be careful so that we can develop herd immunity tomorrow. Thank you. I am going to now put my mask on. I have a reusable mask with a pocket inside, and it has a filter in it. And I have to wear it properly, and I have a nose. I'm going to wear my gloves. I'm going to put my goggles on, and I'm going to put a cap over my head. And I am now ready to go and see my patients. So you be safe, and I will be safe, and we all will go back to somewhat normalizing our life with COVID-19. Thank you.